Hi, everyone. Today I'll be presenting on the Say Yes COVID Test Campaign, an initiative that exemplifies excellent health communication during the COVID-19 pandemic. This presentation will summarize the campaign and evaluate it using the standards of excellent journalism, along with other professional best practices in public health communication. The Say Yes COVID Test Campaign was a collaborative public health initiative launched by the National Institutes of Health and the CDC, which stands for Centers for Disease Control and Prevention. It provided free, rapid, at home COVID 19 test kits to residents of selected U.S. communities. The campaign targeted underserved and historically marginalized populations, aiming to reduce community spread of the virus through frequent and accessible testing. The campaign had five major goals: build awareness about the availability of free test kits, ensure they've reached community members, encourage consistent testing even for asymptomatic individuals, promote informed safety behaviors based on test results, and introduce an optional research component without detracting from the primary public health effort. The campaign employed a diverse marketing effort. Facebook, Instagram, YouTube, radio, newspaper, billboards, and even door hangers. They geo-targeted zip codes, prioritized Spanish language access, and worked with community influencers. These efforts generated over 25 million impressions and led to the distribution of over 1.6 million tests, showing both their reach and impact. On the discussion below, I went ahead and linked their YouTube and some of their videos if you'd like to check out some of the social media that they worked on. According to our textbook, excellent journalism reflects cultural humility, ethical practices, and a service to the public. This campaign did all of these well. It addressed structural barriers to healthcare, respected community identities, avoided sensationalism, and focused on delivering helpful, accurate, and life-saving information. The campaign partnered with local leaders, influencers, and community-based organizations. This aligns with best practices in communication, engaged trusted messages, tailoring messages to local context, and prioritizing relationships over communication. These choices fostered trust and authenticity. Although uptake varied, the Say Yes COVID test campaign left behind a powerful model for future health initiatives, especially those addressing equity. It showed how to reduce access barriers, empower marginalized communities, and how to communicate clearly and inclusively in a crisis. I say yes to the COVID test campaign, which means saying yes to excellent journalism. It is a strong example of excellent journalism and strategic health communication. It embodied the ethical, inclusive, and culturally informed principles emphasized in our coursework and successfully reached the people who needed it most. Thank you.